the Deputy President of the Republic of South Africa to do the opening and welcome officially on behalf of the Council. Over to you, Deputy President.
Good afternoon, Minister. I would like to take this opportunity to welcome all the members of this plenary. As you know, this is my first time to chair this session, so I was getting a lot of briefings, and the minister gave me a long briefing, the co-chair. I even chaired the interministerial committee. So I think where we are, I sort of have an understanding of what we want to achieve and the challenges that we are facing. I'm particularly pleased that there are so many stakeholders that are involved in this matter, and we take it very seriously. Able to get on top of the situation. We did agree, and we will give a report today in the IMC that the current leadership team should continue for a while working with us, and that I'm sure the Minister and Dr. Gulu will report that. So you're all welcome, and the first part of our agenda is really where we make opening remarks, and we allow the media to be with us for that session, and then we're going to get into more substantive matters later. So let me then ask my co-chairperson to make his remarks, and we will then ask the Dr. Sehofatso, who's from the private sector, to also make remarks, and we will later take apologies before we adopt the agenda. As you can see in your documentation, that the minister will speak at a later stage in terms of the program that I have. Co-chair, I don't know if you want to sit in front of
I think
the
might
TV.
be audible.
I'll shift a bit. They'll be able to pick you up, no?
Yeah, we still have the activist voice.
Yeah.
Deputy President, let me again send my greetings to His Excellency, Deputy President of the Republic, Mr. Mashatile, Honorable Minister of Health, Dr. Joe Phaahla, ministers, deputy ministers who are here, civil society leaders who are here, and I do see that the deputy chairperson of Civil Society Forum is also here, Mr. Ndugu. Let me send greetings to representative of the private sector who's standing here on behalf of the chairperson. Panek. Colleagues, comrades, good afternoon. Deputy President, let me take this opportunity to welcome you and congratulate you, on your appointment as the Deputy President of the Republic, but also coming and joining the National AIDS Council. We are really fortunate,
Yes.
Deputy President, to have you, and not only just as the leader in government, but we are fortunate with the rich history that Deputy President represents. You are known to many of us. You bring into the wealth of experience, having served in various portfolios before. You've served as the Premier of Gauteng in the past. You've served as a minister, as a deputy minister, just to name a few. And I think this rich history will definitely contribute to the body of work of SANEC. We wish to also extend our well wishes to the newly appointed ministers and deputy ministers that joins SANEC in their various portfolio for the first time in SANEC plenary. Honorable Deputy President, your new role in SANEC is to lead stakeholders in the HIV, TB, and STIs response. And our response is very diverse, it's inclusive, but we understand our ability to execute this mandate, and we join forces with yourself, Deputy President, to ensure that this mandate given by the people of this country, we protect it, we promote it in the best interest of society. Our role is to continue to support you in this mammoth task, but also to hold you to account in your obligation as the active member and patriot of this country. South Africa has been relentless in the quest to turn HIV, TB, and STI epidemic around. There has been many laudable achievements that SANEC has experienced that we should rightfully be proud of as a country, and also rightfully celebrate, because these achievements could not be achieved without our government and without our strategic partner. The journey normally begins with a small step, but we took it in the great strides that these past years of this ending NSP, despite the impact of COVID-19, we've had a response that has been active, and we've navigated this together with our leadership of government and other sectors. Deputy President, one of the most biggest tasks is the political will and commitment. We seek this in combating HIV, TB, and STIs. One, not only from yourself, but your entire leadership of government. The ministers, deputy ministers, the premiers, the executive mayors, and the councillors, where they are, must remain committed, must produce a strong, visible, active participation, because we want to achieve so much in our national strategic plan. Of course, this responsibility sits solely with the custodian, which is Honorable Dr. Phaahla. We want to deliver on our task that Honorable Dr. Phaahla bestows on this council. The government requires to respond to a number of issues. One, government funding to respond on the increased responsibilities, and we know that there has been contribution from 69% of the cost of the national response. But we are asking that our government show up and upscale this. We've seen it before, and we can achieve this. Let's move from 69% to at least 75%. We want to also see South Africa making this huge improvement on getting people to test for HIV. In recent years, we've seen it. The 2020 targets of 90% of people knowing their status, we have reached it. But we want to do more, because we are in the 95%, 95%, 95%, which is the UNAIDS strategy. The number of South Africans receiving free antiretroviral treatment has grown, Deputy President. And we are happy to tell you that currently South Africa sits with over 5.7 million people now on treatment. We are very close, DP and Honorable Minister, to reaching the target. We cannot fail. The life expectancy, Deputy President, of the people of South Africa is now firmly on upwards trend. South Africans now live longer, and we want to keep it at that, where they can live longer and contribute to society. Of course, Deputy President, South Africa was the first country in sub-Saharan Africa to fully approve pre-exposure prophylaxis. South Africa has shown leadership in the past, launching its own first in the world LGBTI strategy to respond to HIV, and what we are proudly so, the sex worker strategy in that case. So we have been exemplary in being the first for many, and we want to keep it at that standard, Deputy President, with your leadership. Now, Chairperson, despite all these achievements, we should not become complacent. STIs are still a hidden epidemic, and screening strategies continues to be essential for those at higher risk, especially sex workers, men who have sex with men, adolescent and pregnant women due to potential severe consequences to their babies. We need to accelerate our education, our counseling to improve people's ability to recognize the symptoms of STIs and increase the likelihood that they will seek challenge and care or encourage their partners to do so. Deputy President, TB is still the #1 killer in South Africa, and we should not lose sight of what has been approved by SANEC, which is the TB recovery plan. And there should also be clear distinction for the funding for the implementation versus the funding of coordinating the multi-sectoral responsibility. Where you are spearheading all of us, Deputy President, is the multi-sectoral coordination, monitoring of the National Strategic Plan. This is separate from implementation. This is separate when we purchase and procure treatment and when we ensure that we've got condoms and many other things. So we need to actually ensure that through the CEO and the trust and the contributors to that trust that we distinguish that fact. SANEC structures at all levels continue to be unfunded or very poorly funded, and this makes it difficult for coordination to be effectively executed. Now, Deputy President, World TB Day next week, Friday, will mark the launch of our 5th generation of the National Strategic Plan on HIV, TB, and STIs. This is now on 2023 to 2028. This strategy is a truly multi-sectoral approach that is people and community-centered. And we want, Deputy President, with your leadership, we keep it at the level that people are seen and are feeling to be part of that response. It will serve as a blueprint and a roadmap to guide and inform our response in the 3 epidemics working towards an AIDS-free generation. As we move towards the launch of the new NSP, we ought to remind ourselves of our history of HIV, TB, and its STIs response, the progress and the achievements, the critical aspects of challenges that remain unaddressed and that could frustrate our future as the country. All the 18 civil society sectors have been working around the clock in communities to ensure that communities are at the center and intersections are addressed at that level. This includes work done by all SANEC civil society sectors to ensure support in communities. Deputy President, I want to mention just a few. Through the leadership of the people living with HIV, that 5.7 million people that I was referring to, people living with HIV sector has implemented what we call the Welcome Back campaign. This was following the drop or low number of people taking treatment during COVID. And we've seen, to support those efforts, they implemented what we call Richitsi, led again by the people living with HIV. Richitsi going into the facilities where ministers is overseeing the health system. Part of the support system was given by communities to make sure that we don't actually weaken the very challenged health system. In addition, Civil Society Forum implemented what we call Communities Matter. Deputy President, during the period of COVID, over 27,000 human rights violations were documented. It was a trying time for the country, but it is this council that you are leading that includes civil society that is active and that has demonstrated leadership accordingly. However, the data in communities show us that progress towards the 95 targets still varies greatly by province and also by district. Stigma and discriminations are still on the widespread, particularly in healthcare settings. We should do more to support our communities, not by words, but by actions. Large disparities still exist between young women, young men, and sexual and reproductive health and rights programs for the very same youth we are talking about. Deputy President, it's important for the Council and its stakeholders to expand and upscale in order to reach more high incidence location and maximized impact. We need to correct the services and attention to key and vulnerable population, ensure that the decriminalization of sex work, the protection, promotion, and fulfillment of the rights of LGBTI people, people with disability, and children are at the center of our response. As decent human beings, we should speak against unjust system everywhere and anytime. Freedom is shared value and is meaningless if it's not for all of us. At provincial level, Deputy President, there is a need for urgent structure improvement that demonstrate multisectorality. With your leadership engaging with premiers as chairpersons of provincial AIDS councils, together with the provincial co-chairs, we have to pay attention on provinces and districts where we look at implementation plan. You are launching the NSP, must provide us with implementation plans. We are ought to see the provinces hold districts and local accountable. You will see in one of our meetings, Deputy President, we have a color coding that tells us where we are weak in provinces, which district we are not doing well. And this is where we come in under your leadership to make sure there's accountability, but there's also consistency. Very few mayors pay attention on AIDS program. They operate like they are forced, as this task is not part of their performance indicators. We see very little budgeting on the task, and it cannot be right and it cannot be accepted that mayors are not putting resources where they are needed. Now, this special extended plenary is timely and relevant to help us to ensure that through the leadership of all SANEC governance structures, we reach our targets, include reducing the new HIV and TB incidents, increase access to treatment, and AIDS and TB-related death, and continue to drive prevention program in our communities. We wish the new chairperson well in the task and encourage the Honorable Deputy President to work hand in hand with the SANEC family. The SANEC governance structures should hold us accountable, especially when it comes to issues of shared leadership and shared accountability, as it can no longer continue as business as usual. We should be bold, implement vigorously, provide the necessary treatment and support to those infected and affected, monitor the quality of services, fiercely so, and determine the impact of our programs to ensure that we leave no one behind. Deputy President, we welcome you. This is your meeting. We are happy and excited to be led by yourself. Thank you so much.
Thank you very much, Chairperson. I think that was a mouthful, and I've really comprehended a lot from your input. Let's take now this opportunity to allow the private sector representative to be Dr. Tsogofatso.
It's online.
Oh, she's online?
Yes.
She's not with us yet. Dr. Khupane, you have the floor.
No, thank you, Deputy President. And greetings to the Deputy President, the Chairperson of SANEC. Greetings to the co-chair, Mr. Mtsiki, the Minister of Health, Dr. Joe Phaahla, all premiers, ministers, deputy ministers, and MCs who are possibly present. Unfortunately, I'm online. I'm not sure who else is in the room. The CEO of SANEC, Dr. Kulu, the board chair of the SANEC Trust, Mr. Ramkhele, and may I equally take the opportunity from the private sector, Deputy President, to welcome you as the chair of SANEC. Greetings, colleagues. The SANEC Private Sector Forum, or PSF in short, made its formalized launch in 2021. The forum, comprised of its various constituent private sector organizations, aspires to be the platform where the united voice of South African private sector in the pursuit of equality and an AIDS and TB-free society by 2030 can be seen, heard, and grown to support the country's national strategy on HIV, TB, and STIs. The SANEC PSF, with the assistance of the International Labour Organization and Weber Windsor, concluded a stakeholder consultation focusing on addressing governance matters within the PSF, its secretariat SAPCOA, and relationships within the Provincial Private Sector Forum structures and the SANEC structures. Key stakeholders consulted included Business Unity South Africa, Black Business Council, Business Leadership South Africa, SALITA, SOPA, Board of Health Funders, the Council for Medical Aid Schemes, and SANEC. The consultative stakeholder and feedback session held on the 1st of March this year with constituent organizations affiliated to the broader private sector resolved to create a merged organization with SAPCOA, which has a historical role in the space of HIV within the business fraternity. This will enable the private sector to synergistically respond to the battle against HIV, TB, and STIs. This process has been undertaken to ensure that the private sector is not only well positioned to play a meaningful role in resource mobilization, but to also be able to actively participate in all efforts alongside government and civil society in driving the implementation of the NSP with a vision of South Africa free from burden of HIV, TB, and STIs. And we specifically mentioned resource mobilization. I know the leader of the people who just spoke before me will always put it before us that it remains the responsibility of private sector to mobilize resources. As he has correctly stated, that a lot of activities are underfunded, some activities are underfunded. In terms of the specifics of our progress, we are encouraged to report since our last plenary. One, the partners' organizational measure process and activities forward are firmly in place. This includes an implementation framework that will guide the transitional period. Due to